Namaste and good evening, everyone. I, Ritika Gupta, Assistant Director at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti Anusandhan Sansthan, Nai Delhi, extend my heartiest welcome to you all to IMPRI #Web Policy Talk. Today, we are here for a special talk on exacerbating inequality, impact of COVID-19 pandemic on women and work. The speaker for today is Dr. Aparna Mathur. This talk is being organized by Gender Impact Study Center at IMPRI as part of the series The State of Gender Equality #Gender Gaps. I would now like to request Dr. Simi Mehta, who is CEO and Editorial Director at IMPRI, to introduce our eminent speaker further. Ma'am, over to you. Thank you.
Thank you, Ritika, and good evening to everyone from India and good morning to friends in the United States. I hope all of you are keeping well, you are safe and you are healthy, and so is true for your loved ones and everyone around you. So I welcome all of you for this very important web policy talk on exacerbating inequality, impact of COVID-19 pandemic on women and work. And I am so delighted and privileged to introduce to you our eminent speaker and also our eminent chair and discussant for the session. So I would begin with introducing our speaker for the day, Dr. Aparna Mathur. Dr. Mathur is a senior manager in economics at Amazon. In this role, she tracks and conducts research to help identify labor and employment related challenges faced by Amazon's domestic and global workforce with a view to informing the best policy. Prior to Amazon, she spent a year as a senior economist at the Council of Economic Advisors. She had joined the council as part of the COVID-19 response task force at the peak of the crisis of COVID-19 in April 2020 and worked closely with epidemiologists on the health aspects of the crisis, while also tracking the economic downturn that came along with the lockdowns. And prior to joining the council for 15 years, Dr. Mathur was a resident scholar in economic policy studies at the very renowned think tank, the American Enterprise Institute. At the institute, she directed the AEI Brookings project on paid family and medical leave, including a bipartisan momentum on paid leave, for which she was globally recognized and also in the Politico 50 list for 2017. She also co-authored a novel empirical paper on the incidence of the corporate income tax on workers, which became a prominent policy debate during the passage of the Tax Cuts and Job Acts in 2017. Dr. Mathur's academic research has focused on income inequality and mobility, tax policy, labor markets, and small businesses. And ma'am has published several journal articles in top scholarly journals, including the Journal of Public Economics, the National Tax Journal, and the Journal of Health Economics, and testified several times before the US Congress and published numerous articles in the popular press on issues of policy relevance, including her own blog at Forbes. And she has been widely cited by leading news magazines such as The Economist, The New York Times, The Wall Street Journal, and The Washington Post. She has regularly provided commentary on prominent radio and television shows such as the NPR's Marketplace and the Diane Rem Show, as well as in the CNBC and C-SPAN. Dr. Mathur has been an adjunct professor at Georgetown University's McCourt School of Public Policy. She received her PhD in economics from the University of Maryland, College Park in 2005, and is currently on the University of Maryland Economic Leadership Council. She is also on the board of the National Academy of Social Insurance, as well as the National Economists Club. So thank you so much, ma'am, for joining us. And it is our privilege that you were able to take time from your schedule to deliver this lecture. Thank you, ma'am. I would also like to introduce to all of you our discussant for the day, Ms. Suhela Khan. Suhela has an extensive experience in the management of large-scale transformational programs on women's economic empowerment. She aims to integrate feminist principles and strategies in programs to enable women to recognize the challenge of discrimination and gender-based violence as a prerequisite to advancing their economic rights. Her expertise lies in the areas of program development, implementation, monitoring, measuring impact, and partnership building. And previously, she has worked with central and state government. And currently, she is at work at UN Women, and she is leading the European Union's We Empower Asia program. The program aims at enabling women to access business and leadership opportunities in the private sector. Her experience has helped her to develop a close understanding of the intersectionality of gender and other forms of identity and the challenges faced by them. Suhela has provided technical inputs and edited several publications on gender equality and women's empowerment. Suhela has been a Ford Fellow and holds a master's degree in public policy from the University of Michigan. Welcome, Suhela, and it is always a delight to be with you. Thank you so much. And as we will be joined by Professor Kelkar, I would make an introduction for her. So thank you so much. And I would now invite Dr. Aparna to begin with her presentation. Over to you, ma'am.
Thank you so much. Let me see if I can share my screen. It's such a pleasure to be here, and it's great to meet all of you and to listen to all the work that you're doing. And I want to echo what Simi said earlier. I hope everyone's families are safe and at this very, very troubling times in India and globally. So I hope I'm glad for all of you who could make it here, and I'm really grateful to IMPRI for inviting me to do this talk. So the focus of my talk today is will be to talk about inequality and how COVID-19 has exacerbated or has likely exacerbated inequality, especially when it comes to gender-based issues. So my talk will look at the impact of COVID-19 on women and work. Now, I recently joined Amazon as a senior manager in economics, and as Simi mentioned, the focus of my work will be on labor market issues and trying to understand best policies there. But I do want to make clear that all of the work that I will be presenting today is, I will not be speaking as an Amazon representative or as an Amazon employee. These views represent my opinion. All of the analysis that I will be presenting today is based on official US government sources or data that I've collected from India myself, and not anything that is proprietary to Amazon or any research that is being conducted currently by Amazon employees. So just to be clear that I'm speaking on my own behalf, and also, as we mentioned, I've served a year as a senior economist at the White House Council of Economic Advisors. And for 15 years prior to that was at the American Enterprise Institute, where a lot of this work that I will be talking about today was motivated. So just to be, just wanted to put up that disclosure up front. The COVID-19 pandemic, as we're all aware, was a massive health and economic shock across the world. So I remember in April 2020, when I was at AEI, I was invited, to come and work at the White House at the Council of Economic Advisors, because this was one of the worst crises that the country had faced. And it wasn't just the US, of course, it was global. But the kinds of numbers we were seeing, both on the health front, the economics front, were shocking. Globally, if you look at GDP declines, so massive economic declines in national economic output, in unemployment, in on the health side, we were monitoring the impacts on infection rates, on cases, on deaths. And I think it would be fair to say that it was an unprecedented disaster, and it was, not something that countries were really prepared to handle. So initially, when we started tracking infection rates, cases, the steep increase in death rates, we were working with a lot of the epidemiologists, at the White House, trying to understand, well, what trajectory will this virus take? And I feel like some of that modeling still needs to be done, as we're seeing, in India, cases are continuing to increase. All of last year, I think caseloads were much lower, and now we're suddenly seeing the steep hike. And it's a really difficult, just to be fair, I think it's a really difficult task for any, doctor, modeler, epidemiologists to really sit down and say, well, how, what is the virus going to look like? What is that wave going to look like? And we tried to do that. We were doing our own modeling, and it's really hard to predict, because it's not a virus that people had seen before. As we all know, many of the cases were asymptomatic. You didn't know if somebody was infected or not infected. And so I think what started as a massive health shock for the country and for the world quickly, changed the way we ordinary people started doing business. And it started coming out as self-enforced behavioral changes with people stopping work. So I remember, I was in DC, and there wasn't sort of this federal announcement that people should stop working, but the fears of the virus, the increase in cases that we had started to see, we started informally sort of stopping ourselves from going out to eat. We stopped going into work as much as possible, only going in for meetings that we had to. People stopped going to movie theaters. People stopped shopping. A lot of our stuff became remote, became digital, became online. And so it initially started, coming out as self-enforced changes in behavior. I remember doing an analysis at the White House and thinking, even before a lot of states had lockdowns, even before a lot of states announced school closures or work closures, people had started behaving very differently. And so what started as a health shock then, led to this change in the mental way of how we think about doing our business, about how we go about doing our business, and then led to changes in state and federal policies, resulting in lockdowns, mandates, closures of schools and childcare centers, closures of businesses, only people who had to be like essential workers, grocery store workers, healthcare workers were required to be, our frontline workers had to be out there, but everyone else was advised to stay at home and to do all of our work as remotely as possible. So what did all of that mean in terms of official statistics on the economy, on health cases? Well, we started seeing massive increases in unemployment, massive declines in income. People lost jobs. We're talking about many different types of jobs. As I said, when we stopped going to, retail outlets, people stopped shopping in stores, people stopped, going to movie theaters, people stopped eating out. All of that resulted in massive declines in employment. A lot of people lost jobs. When those workers lost jobs, that meant income losses for the family. That meant, in a few months, there was a tremendous amount of food insecurity. People did not have enough money to buy food, to buy food for their children. There were lots of surveys that came up in the US, and I'm sure in India, that started tracking what was happening on the food insecurity front. It led also to housing insecurity as, people couldn't pay rents, people couldn't pay their mortgages. That meant that people, there was a risk of eviction. All of these things that we started tracking, which stemmed from the health shock and then the economic shock. And we started, sort of tracking all of this. And of course, in the US, there was, and in India, there were massive economic relief packages that came about precisely to address the challenges that the country was facing, whether it was unemployment, whether it was small businesses going down, whether it was food insecurity, whether it was rent, a lack of ability to pay rent. So there was a lot of effort. We passed trillions and trillions of dollars in relief packages, just trying to make sure that people were held whole, that, if the pandemic continued for 6 months, if it continued for a year, that there were programs in place that people could rely on to get unemployment checks when they were out of jobs, to get small business support through the Paycheck Protection Program and so on. But despite all of that relief effort, obviously the impacts of COVID-19 have been very uneven across the economy. And so the other thing we started tracking were these differential impacts across industry, across occupation, across gender, across race. Okay, because like I think if we think about it in our own lives, if we think about the kinds of jobs we're doing, as opposed to the kinds of jobs, let's say a grocery store worker or a restaurant worker is doing, obviously the impacts across the economy were very different. A lot of us did easily transition to remote work. Yes, it meant a lot more, Zoom events and Zoom conferences, but there was also very quick adaptation. There was very quick, ability to adjust to that change. But if you think about a healthcare worker who had to be on the front lines, if you think about the restaurant worker who lost his or her job because people had stopped eating out. If you think about the movie theater, janitor who no longer had a place to go to, those impacts were very different across the economy, and a lot of it stemmed from the kinds of jobs that people were doing and the kinds of jobs that suffered the biggest hits as a result of COVID-19. So when economists started looking at this particular recession, a term that quickly became, popular and has become popular is what's called a she-session. And I remember when, the first time I heard a term like that was during the Great Recession, when we were calling it a man session. And I think what's unique about COVID-19 is, and there's a lot of research, and I'm citing some of the papers here, is that in typical recessions, the kinds of industries that get hit are, not the service industries. The industries like manufacturing, like construction. This was particularly true during the Great Recession. And when those industries get hit, in terms of gender, that hits men more. And so the Great Recession was a man session in the sense that the initial impacts of the recession were on job losses amongst men. What's different about COVID-19 is that it's a she session, that it's the impacts of COVID-19 have been particularly stark for women. Now, again, typically what happens during recessions is that as men lose jobs, women enter the labor force in greater numbers, and this adds a form of household, income stability, security, because, one spouse's income goes down and, women enter the labor force, and to some extent, they offset the income losses that are coming with the job losses. But what happened during COVID-19 was very different. COVID affected service industries more, as I said, things like retail trade, leisure and hospitality, trade, healthcare workers, which are also primarily women frontline workers. And so the effects were felt most by women. So on the one hand, the kinds of industries that were being hit also tend to be dominated by women, which is where the biggest job losses started coming in. At the same time, why this is a she session is that there was also a closure of schools and childcare centers. Now, what did that mean for women? Using data from the official current population survey, so the CPS, the current population survey, is a micro level, household level data set that the US government has built up. Which tracks people's employment and earnings and other household statistics and demographics over time. And what the CPS data has started to show is that the employment drops for women, and this is very specific to the US, what I'm talking about, and I'll discuss India in a minute. The employment drops for women were more severe than for men at every stage of the pandemic. So, and this is particularly true for married and single women with children. Now, why with children? So on the one hand, of course, women were getting hit because of the kinds of job losses that we're seeing, the kinds of industries that were being hit, like retail and leisure and hospitality and so on. But it was also the simultaneous shutdown of schools, the simultaneous shutdown of childcare centers, which severely affected the ability of women to actually participate in the labor force. So we're seeing that amongst parents, we're seeing much larger drops in employment amongst parents than we're seeing amongst families without children. And that's likely driven by the fact that, one thing that makes it possible for women to participate in the labor force is the ability for them to have childcare options, the ability for them to have children being in school while they're at work, instead of having to also provide childcare at home as they're simultaneously working. So if you look at the effects of sort of COVID-19 on women, prior to COVID-19, I remember writing a blog and celebrating the fact that women, were now 52% of all employment. That was one of the sort of the first times after a long time, I think after the Great Recession, when women were a majority of the workforce. And just as soon as we started celebrating that, COVID-19 hit. And the most severe effects of COVID-19, as I said, on employment were felt in the spring of last year in 2020, when women accounted for 66% of the job losses that the pandemic caused. Over the summer, it was about 63%, and over the fall, about 59%. Now, we are starting to see some reversal as the economy has reopened, as schools are starting to come back to in-person learning, as childcare centers have received aid from the government and have reopened. We're starting to see some of that employment decline reverse, but some of these effects, as we worry, are likely to be longer term. Non-participation, so it wasn't just the drops in employment that are very stark for women. It's also that a lot of women just stopped participating in the workforce. So the way the CPS defines women as being, and people as being employed or unemployed, is to ask them the question, have you been actively looking for work in the 4 weeks prior to when you're doing the survey? Now, if you're not looking for work, you're classified as a non-participant. So you're not actively in the labor market. And you're not looking for work. So we're not going to call you employed or unemployed, but you're a non-participant. And that is also a big worrying indicator during COVID, during the pandemic, is that we're seeing very high levels of non-participation in the labor market, again, for women, and particularly for women with children. So women accounted for 70% of the total non-participation in the spring, as they started dropping out of the labor force. 86% in the summer, and almost 100% in the fall. So by the fall, as I said, as economic activity started rebounding and people started coming back, we did see some employment losses start to reverse. We're still, I think, about 50% of the way down. But when you look at non-participation, the increase in non-participation, that is now primarily being driven by women. And it's interesting, I was reading a recent survey that said that this is not, at the back of our mind, when we look at these statistics, we think about women who are relatively, low income, who are working in industries that are, offering hourly or part-time jobs. But this is also a situation that we're seeing in senior level women. We're starting to see high levels of dropout amongst women who are at the top of the corporate ladder, who are, starting to rethink, can I continue to manage the responsibilities at work with the responsibilities at home? So at the back of your mind, I would, it's important to keep in mind that we're not just talking about people at a certain income scale. This is a recession that's affecting women across the board. A lot of women are stepping back, are trying to sort of cut down on work responsibilities as they're taking on more and more responsibilities within the home. Now, the worry is that employment drops and non-participation can be just can be sort of is not just a one-stop thing. It's not just a short-term thing. This can actually lead to longer-term impacts on the gender wage gap. Now, even prior to COVID, all of the research that economists and others were doing on the gender wage gap, we kept saying, well, a lot of this is driven by the fact, I think, that women tend to choose certain types of jobs that probably allow them to meet responsibilities within the home. There's a lot of you look at the weight that women place on flexible jobs, on the ability to take up part-time work, on the ability to, to take on a job that would allow them to manage responsibilities, caregiving responsibilities at home. A lot of women don't participate in the workforce because of those responsibilities, because they're viewed as the primary sort of caregiver within the home. But that COVID is going to exacerbate those trends. As we're saying, employment drops are more severe for women, and a lot of these women eventually may end up completely dropping out of the workforce. And if that happens, then this wage gap, the gap between men and women, between mothers and fathers that we tend to ascribe to the child penalty, is only going to grow. So that is another big worry, that COVID-19 is not just going to have short-term impacts on women's employment and labor force participation, but also longer-term impacts on participation and the wage gap. COVID will also affect, gender participation in the long run because of structural changes in the types of jobs that will exist after COVID. So we've had now a year of experimentation where a lot of us have realized that, yes, there are many jobs that can now be done, that can be automated. There are many jobs which actually don't require in-person, people to come in and to actively be in the office. And so a lot of jobs are going to be automated away, and many of these are going to be service jobs. So you think of, people working at a fast food drive-through. You think of people working at grocery store checkout centers. A lot of those jobs are going to be automated. A lot of those jobs are going to go away, which will again affect women's employment, affect their participation. Even jobs that are very contact-based, such as home healthcare workers, retail workers, are very susceptible to this change because, we've had a year, as I said, of adapting to a different style of work, a different, need for sort of actually hiring labor. And employers are figuring out, well, there's a lot of stuff I can do by putting a computer in place, by allowing people to order online, by allowing people to, do stuff remotely. And so there'll be a lot of rethinking about the way jobs are organized, about the way office spaces are set up, about the way, certain types of work can be done. And so there's a big worry there as well that this will lead to gender inequality or reinforce gender inequality in the long run. And this is, again, a global phenomenon. As I said, some of the statistics I presented earlier are very US focused, but we're seeing this across the board. We're seeing this across the world, where employment declines have been particularly concentrated among women, especially amongst parents of school-age children. The declines have occurred not just in actual jobs, but in hours worked. So women are cutting down in terms of the hours that they're putting in, even if they're not completely moving away from jobs. The gaps in employment and hours are widest amongst those who cannot telecommute or have flexible schedules. So again, people are changing the kinds of jobs that they are engaging in, and the fewer the options for remote work, the bigger the gaps. The more likely it is that women will drop out or cut down on hours worked. Even in cases where both parents are working remote, we see that productivity declines have been larger among mothers with school-age children as opposed to fathers. So that tells you that the brunt of caregiving responsibilities within the home continue to fall on women. And even across the world, a lot of this can be explained away by the kinds of industries that are being hit, like tourism, leisure, and hospitality. But a lot of it also has to do with the closure of schools and daycare centers, which have typically enabled women to participate more actively in the labor force. Now, I also dug up some statistics on India. Pre-pandemic, again, in India, women's labor force participation has been a big issue, even prior to the pandemic. So data from the World Bank shows that labor force participation fell from a high of 32%, about 15 years back, to about 21% in 2019, which is pre-pandemic. Now, this is much worse, I would like to point out, than many of our neighbors, than many of the countries around us, many developing countries. This gap has become much worse during COVID-19. So I was reading some statistics that said that women's drop in LFP has been about 10 percentage points. So imagine going from 21%, which is already well below what we see in comparable countries, to something like 10 or 11%. So about 10 percentage point drop in women's labor force participation. and men haven't dropped as much. I don't think the goal is to have, low participation rates for both men and women. The goal is to have much, much higher participation rates for men and women. And unemployment rates are nearly 3 times higher today for women than for men. So we're really starting to see, this becoming a bigger and much bigger issue in India. And I was trying to understand what was happening pre-pandemic relative to, of course, during the pandemic, the hits were different and women were hurt more. But even pre-pandemic, 21% is a very low LFP rate for women, and we really need to go back and understand what's driving that. And I'll talk about a few of the factors here. Now, as I said, low labor force participation rates are problematic because they lead to wider wage gaps. It also leads to lower levels of autonomy within households. I think in households where men and women roughly earn about the same, there's a lot more equality within, there's a lot more bargaining power that women have within the households. There's a lot more independence, a lot more autonomy, fewer rates of domestic violence. If women are more autonomous or have more income and wealth, we show from research that they're likely to marry at later ages. They have a lot more say in when they have children. And all of that leads to this, positive sort of virtuous cycle of having more autonomy, more independence, but also having more stability in their careers, having more stability in their family life, being subjected to lower rates of, incidents of domestic violence and so on. What we saw during COVID, which doesn't surprise us because we're seeing, these big drops in employment and participation, data from the Asian Development Bank shows that there was a 131% increase in domestic violence complaints in areas with the strictest lockdowns in India. So these problems are only going to get worse. India is not out of COVID-19. I'm not saying that the world is, but we're seeing much higher cases in India right now than anywhere globally. And so these are things that, once we deal with the health aspects of the crisis, these issues are only going to get worse. In general, reasons for low labor force participation are that, there's this sort of, I think, a mindset in some parts of the country that if the husband is earning a decent living, women don't need to work outside the home, that their primary responsibilities are within the home. So that leads to there's an active sort of discouragement from working outside the home. There's also violence. We see, I look at National Crime Records Bureau data on cases of violence against women. As those cases go up, women are more hesitant to step out. Families are more reluctant to have daughters and, wives and women step out into the workforce. And the technology divide will also worsen as, technology divide currently amongst men and women is also pretty stark. So women have lower access to mobile phones and internet than men. And COVID-19 will just exacerbate this digital divide. We're going to move to a world where remote work is more and more acceptable and more prevalent. And if women don't have access to the same levels of technology, then they're going to lose out in the long run as well. Just very quickly, again, we talked about wage gaps also driving some of the low levels of labor force participation, because even if you're actively in the workforce, we see that women are paid less than men. Now, some of it could be again ascribed to the kinds of industries and the jobs they take up. But it leads to lower levels of independence, lower levels of autonomy, lower levels of participation. And one thing I guess Suhela will touch on is small businesses. Women-owned small businesses have also taken a big hit during COVID-19. And so we need to be doing a lot more to support those women-owned businesses as part of economic relief packages in India. India has also been slipping in 2021. The World Economic Forum report shows that India has slipped 28 places. So it's doing much worse than, again, other South Asian countries. And it's doing much worse on specific indicators like political empowerment of women, on health and survival dimensions, economic participation, economic opportunities for women, educational attainment for women, and so on. So the gender divide is only getting worse. The share of women in technical roles has declined in 2020, and all of this leads to reduced earned income, reduced, greater gaps amongst men and women within families within the country. Just very quickly, what are some policies under consideration? Now, what happened in the US immediately was that we expanded the social safety net. We put in unemployment insurance supports. We expanded the size of cash payments that were being made to people who became jobless as a result of COVID-19. We expanded the eligible pool of people who could take up, which included people who were just doing informal work, gig economy work, contractual work. Typically, they were not allowed to take money out of the unemployment insurance program. But during COVID-19, they were made eligible for that. There was a paycheck protection program that was put in place that allowed small businesses to receive cash so that they could keep workers on payroll, even if there was no active demand for the product, but at least they could provide some. They could let the business survive those initial 6 months, 7 months before some level of reopening happened. It's not clear to me how much of that has been done in India. The unemployment insurance system seems to cover only the sort of workers in the organized sector, but as we understand, a lot, more than 90% of the work in India happens in the informal economy. So I think we need to try to figure out how to help, people who've lost jobs in the informal sector as well. How do we make unemployment insurance available to them? How do we support women-owned businesses and generally small businesses to survive COVID-19? I've written a lot about paid family and medical leave, paid parental leave. I wrote a piece in Livement when India, extended its paid maternity leave benefits, saying that one, it shouldn't just be paid maternity leave; it should be paid parental leave, because we need both men and women to take up the leave. That if we make leave around childcare just focused on women, then we're continuing that gender divide. We're making sure we're sort of telling the world that we believe women are the primary caregivers and it's their job to look after the children. But we need to have instead paid parental leave that's open to both the mother and the father and allow fathers to take on, that role as well. So we need paid parental leave. We need to offer more childcare options that can be within the workplace. It can also be some subsidized childcare support that allows women to participate more actively in the workforce, while at the same time, being able to afford good, high quality childcare for the kids that they're leaving at home. We will need to adopt longer term programs that enable women to succeed post-pandemic. As I said, a lot of the industries that they were in are likely to be hit and those jobs are going away. So how do we make the right investments in education and skills training so that they're prepared for the new jobs, the new structural, the structural changes in the workplace that we're likely to see. There are interesting papers on how the reservation for women in the Panchayati Raj, system actually did lead to more empowerment for women. So, why are we dropping on that index in the World Economic Forum report? What is going wrong there? Why are we not improving on the political representation piece? I've also done a paper on inheritance rights in India and how the fact that daughters were made eligible to receive the ancestral property similar to sons actually did lead to higher levels of economic empowerment for women and to lower levels of domestic violence. So, just trying to say that the more wealth transfers we can do to women, the fewer the incidents of domestic violence, the more autonomy, the more empowered women feel. And finally, just a call for flexible workplaces. At a time when we are seeing, that, and I'm not just saying women, but men are facing much more caregiving responsibilities within the home. We have parents who are sick, who are elderly, who need that time, who need that time from us. I think employers need to be a little bit more flexible in the workplace about giving that paid time off, about giving, that space so that we can meet those responsibilities. Those are some of the changes I would start with. as we think about policies post-pandemic that governments, not just in India, not just in the US, but around the world can adopt. So I'm going to stop there. Thank you so much and look forward to questions.
Thank you, Dr. Aparna. What a wonderful presentation. And you have clearly pointed out so many different aspects, and it was really, really enriching. I just thought that you could just go on and on. Thank you so much. So I would, okay, we just received a message from Professor Kelkar. She's stuck up in an emergency, so she's not able to make it. So she regrets, and we too. So I would now go to Suhela for her discussion points. And after that, I would be making a few points. Suhela, over to you.
Thank you. Thank you so much, Sini, for having me here. And thank you so much, Aparna, for such an insightful conversation and insights, not only for India, but also for US as well, because I think when we make comparative studies, a lot of things come out that we normally miss out in our efforts to make policies and practices that are more relevant to people. But let me begin by reflecting a little bit on the labor force participation rate in India, which is truly at a crisis level, and has been going down since last decades. In addition to some of the points you mentioned, Aparna, there are also evidence and reflections on the fact that there's increased access to education for women. So now more women, because more women are enrolling in higher studies, this is taking away their opportunity to participate in labor force. But also there is argument against the measurement of the labor force participation itself, considering the fact that a lot of women, apart from care work that they do, also do unpaid work that directly leads to productive activities, and hence measurement is also an issue. But then again, there are other studies and arguments around the fact that also, that also helps us to understand that why labor force participation is low. And you touched quite a few of these points, including unpaid care, which is really in this part of the world, at least in India, is quite high, even than our neighboring countries, right? Women end up spending more hours on unpaid care work than the counterparts in the neighboring countries. But what makes it more worse is the lack of infrastructural facilities too. For example, the lack of access to water, the lack of access to clean fuel, which also increases their time poverty and time burden and takes away the opportunity for them participating in economic activities. Also, you did mentioned about the fact that there is a lack of safety and security in public and private spaces, and that is something which is very important, and what we are witnessing now increasingly in cyber spaces as well. There is sexual harassment. There are new ways of sexual harassment that is coming up during this work from home scenarios, and there are complaints that are coming up which we never thought of. So really, on one hand, we are trying to adapt to this COVID situation, but parallelly, there are, challenges that are being created, which needs to be looked on and which needs to be reflected on. Also, the fact, Aparna, the lack of flexible working opportunities for women. I think this is something which is very, very important, and you rightly touched upon that because of their care responsibilities, they are looking for opportunities that provide them flexible work options, but there are not many opportunities that exist for women, at least in majority of the women in the informal sector, where in India, 92% of women are in the informal sector, and only 8% are in the formal sector who have access to such benefits, but not the majority of women in India that we are talking about. Now, if I would also like to reflect on the fact that, even the job creation process in India has not been consistent with the economic growth. And even if you would look at, service sector where a lot of jobs have been created, again, these have been created in a manner that are traditional jobs, which still keep women in the informal and vulnerable sort of settings. So, these are some of the reasons that have aggravated, women's burden and limiting their access to economic opportunities. Now, if we look at COVID and similar pandemics in the past. So UN globally did a study after looking at the gender impact of Ebola crisis on women. And what they found is that after the preventive measures have subsided, it was easier for for men to go back to the pre-pandemic stage as far as employment and jobs were concerned. But it was very, very difficult for women to get back to that job or the work that she was doing, and it took a considerable amount of time for women to be integrated into the economic activities again. Now, in India, we are looking and we are seeing the similar trends. There is data out by CMIE which says that that the job loss is more prominent among women and the employment loss is more prominent among women than men. Now, what is it that impacts this? What is the reason behind it? Of course, if you would look at women's traditional disadvantage in lack of access to land, access to capital, access to finance, and access to markets, right? This is something which aggravates this the pandemic crisis for women, but also this coupled with this added responsibility of unpaid work, as you rightly pointed out, closure of schools, but also taking care of elderly at home, and also the fact that most of these women have faced and are facing violence, as you rightly pointed out. So these are some of the issues that we are facing, and these are getting aggravated. Now, if again, the fact that if you would look at the majority of women, 92 to 93% of these women are in informal sector, with only 8 to 9% are in the formal sector. Even in the formal sector, a very limited percentage of them are in leadership positions. A lot of them are at the lower level. So it's also something which needs to be reflected on. But if you would look at the composition of the 92% of women, these are majorly, who are they? These are home-based workers, construction workers, domestic workers, or the vendors who run, the trolleys, selling fruits and vegetables, and entrepreneurs. And these are largely micro, small, and medium enterprises. Now, not large enterprises, but really small and micro enterprises in the informal sector. Now, we did a study at UN Women in India to assess the impact of COVID-19 on women-led businesses. And what we found was that, and there was a representation of women across all states. There are 106 primary interviews that we conducted and surveys that we conducted, and found that one of the things that is most challenging to them is really looking at access to finance, because the fact that even the government of India's package that was introduced was for those women who had some prior history with banks. Now, when we spoke to a lot of women, they said that they have not engaged with the formal banking system at all. Instead, they rely on their relatives and friends and families when the need arises for them to access finance. And this is true. Majorly, this is true. Now, so what are the policy implications for this? Also, the fact what we found is that a lot of women, rural women, have been able to pivot. If you would look at the data, the self-help groups who have quickly adapted themselves to start developing masks and PPEs and all that and selling. So there is a potential in women to take the risk and try to pivot. But what they really need is access to working capital, right? Because that is something which they lack. And if that is something which is provided to them, they could, of course, pivot and try to enter into new productive activities. So even there is a need of such mechanism that is able to provide, at least at this point of time, the working capital, which doesn't comes with conditionalities and which is easier to access. Now, also what this women entrepreneurs said that, at this point of time, what we are struggling with is mentorship and networking support. Very specific mentorship to their businesses, because they do not know how to navigate the impact of this crisis. The crisis has led them the issues around finance, issues around markets, issues around working capital, etc. So they do require very specific mentorship and networks. Now we know that women do not have that kind of network that men have. So men are able to navigate this by access to e-commerce platforms and all that stuff. And we know the women's representation and participation in these platforms are not equivalent to what men's participation is. So what is it that is required to be done? A few things. Of course, one is that we would be it would be really great, if there is women's access to finance and capital, with taking into consideration these structural constraints and background, etc., of their limited access to land and collateral, and try to make sure that they have access to that finance. Also, the fact that working parallelly with ecosystem players. For example, e-commerce platforms like Amazon. Aparna, I know that you are not here in the capacity of representing Amazon, but these platforms have great potential, right? But one of the things what we found also discussing with these women entrepreneurs, that even on platforms, e-commerce platforms, they face challenge of navigating those platforms, because they are also technical platforms. So for example, some of those find it difficult that they don't see their products coming on first search, right? Or they don't know the technicalities of the price differentials that goes up and down, right? So so what we think is that even as stakeholders in promoting enterprises, I think e-commerce platforms has a big role to play in terms of developing the capacities of women entrepreneurs to be a part of their system, right? To be a part of, and taking proactive steps to be able to make sure that they are part of the value chains. I just would like to very quickly share that on International Women's Day, together with Amazon in India, we launched something to facilitate this for rural women who are running small enterprises. But give me 2 minutes, Simi, I think, to talk about my women's entrepreneurs WeEmpowerAsia program. Thank you. So what we are trying to do in WeEmpowerAsia program is that we are working with the private companies, corporate sector, to make their policies and practices more gender responsive at the workplace, marketplace, and communities. And this we do by really motivating them to voluntarily commit to 7 women's empowerment principles. But the idea is to really technically support them. So we are working with the signatories of women's empowerment principles to actually build their capacities in implementing those principles. Now, globally, there are some close to 5,000 companies that have signed women's empowerment principles. And in India, we have some 222 signatories right now. I'll just very quickly run you through these women's empowerment principles. So it starts from the workplace itself, to see that, what steps could be taken at the leadership level. So we see that, until and unless a commitment comes from a leader, it won't translate into action, right? And when a leader, states his or her vision of promoting gender equality, it really gets translated down to the lowest tier, and some sort of accountability mechanism is set. So the idea is to really get the CEO's commitment towards implementation of these principles through signing a voluntary statement of support. But then also looking at that what policies and practices should be in place to enable women to come to cross that career ladder, and be at the highest level. So the idea is to support them in looking at their recruitment, hiring, retention, promotion, flexible policies, maternity, parental entitlements. Aparna, you pointed a very relevant point here, but also the fact that if you would look at their marketplace policies, to see that how consciously they are reaching out to women-led businesses to include them as part of their supply chains. Because there are a lot of women enterprises, small, micro, medium, who are producing a lot of goods and services, but they do not either have access to networks, access to information, or skills to be able to compete with large vendors. So how proactively the larger corporations are trying to ensure that they proactively reach out to these women entrepreneurs and make their policies accessible to them. Also, when they do their marketing practices, for example, how sensitive they are in not promoting gender stereotypical content. And when it comes to their community interventions, what we try to work with them is to see that, of course, education, investment in health education is very critical from the perspective of their CSR. But why not also invest in structural constraints that women face, that limits their participation in the economic activity? So really looking at the issues of mobility or transportation, right? Making available safe transport facilities, or addressing violence, gender-based violence. The fact here, Aparna, is that there is a lot of normalization of violence here in India. Even the fact that sometimes if you speak with a lot of women, and this has been my personal experience, that they don't think that it is a violation of their right or a discriminatory practice against them. They think that it is their destiny, because one, they are not aware that that this is a violation, and that they're not aware what are the redressal mechanisms and how to address this. So a lot of work needs to be done on that aspect. And if CSR initiatives are invested in some of these activities, I think we can really see, a lot of uptake by women in employment opportunities. Also, looking at their and the final principles is about transparency and monitoring. So the idea is really not the fact that the companies should report us. We are not requesting any report from them, but what we are saying is that if you have signed women's empowerment principles, when you are preparing your business responsibility or business sustainability reports, please please make sure that the information on gender indicators is also provided, right? Because until and unless you create yourself an accountability and transparency mechanism, this dream is quite far. So yeah, these are some of the initiatives which we are undertaking. I'll stop here and look forward to questions. But thank you so much, Aparna. That was an enriching presentation. And thank you, Sumi, for having me here.
Absolutely. Thank you so much, Suhela. Very pertinent points, as always, that you make. Thank you so much for adding to the richness of the discussion. And I would just mention here to you that we at IMPRI, Impact and Policy Research Institute, have also started the process of the signatures for the program that you lead. And we are almost through it. So thank you. And we completely commit ourselves to those principles. So thank you. And also, Dr. Aparna, I would just like to make a few points, because you have made so powerful points, especially when you talk about the she session. The job losses that you have mentioned, especially when we are talking about India. And Suhela just briefly mentioned about the CMIE survey report that has just recently come up. Well, previously last year also it came, and they reported a lot of job losses, etc. But this time what they are saying is that around 7.35 million job losses have happened only in the month of April. And this is just due to the second wave. And while even in the first wave, it disproportionately impacted women, this time it has been further worse, wherein the employment rate for women has shot up 17% more than 17% more than double rate for men. So we can just imagine the massive challenges that women are going through in terms of their finances. And this kind of lower wages and also lower wages due to job losses, and also due to other reasons, it is having a lot of implications on their mental and financial health. So the savings have reduced, and then savings have reduced, which leads to food and health security. And just last year, if you may recall, India stood 94th out of 107 countries in the Global Hunger Index. I just shudder to think what the situation will be for the year 2021. And overall, also in terms of because in terms of access to various services and amenities, women tend to defer their priorities to their children or to the men folk, or they stand behind the line, and they mostly rest their decisions on the decisions made by the men of the household. And this also is having its implication on the vaccine hesitancy. And many reports have come that women are foregoing it in the interest of the male folk. So this is again a challenge of health security that is coming up, and a lot of mortalities are happening because of the pandemic on women. Then I would like to point out about the Atmanirbhar package, which our Prime Minister had released last year, the 20,000 crore package, and which is being really touted as a very important step that has been taken, no doubt, very important, no doubt. But he has also mentioned about the number of 20 lakh crore Atmanirbhar package, and he has also mentioned that 80 crore people are the beneficiaries of it, 80 crore poor people. So we are clearly pointing out to the number of poor people that we have in India at the, on the one hand, and then we are having so many complex, this 80 crore people having access to the Prime Minister's PDS scheme. So of providing free grains. So and then when we talk about the infrastructure support, which you also pointed out, for those women who have who are forced to work from home, because but they do not have the basic infrastructure facilities, be it a mobile phone or a device or a laptop or a computer, or even and of course a working internet. That is another challenge. We face internet connectivity issues almost on a regular basis, but even if they have, I mean to say, even if they have all these infrastructure support, their work is also hampered when they have to give it up in favor of their children who are pursuing online education. So then again their work is hampered, and then they are at the losing end of their jobs. So these things need to feature whenever I think policies are being made, or a little bit of empathy needs to be there when we are talking about how the country's women are impacted. And certainly you pointed out about the increased burden of care work, unpaid care work. There is added to that is, Dr. Aparna, a lot of increased incidences in domestic violence in our country. So where are we going from here? In one of the sessions, Suhela had mentioned about, she participated in the domestic violence webinar. And how are we going to navigate through this? Because are we preparing ourselves for the third wave, or are we going to just have a status quoist approach? You pointed out about the parental leave, but the reality is really otherwise in the country. So certainly the whole inequity that has been exacerbated by the pandemic is really getting worse and worse, and this really needs to be the focus of all policy actions at the moment. So yeah, that is my view from here. Over to you, Dr. Aparna, if you would want to respond.
Thank you so much, Simi. Yeah, I hear you and Suhela completely echoing. We're all in the same sort of saying the same thing. I think, any metric you look at, any statistic you want to, ponder, it just seems like there's this big divide, and it's a divide that COVID is widening, but it's a divide that has existed prior to COVID. And I think, we really need to start thinking about policies now, because, as Suhela was saying, and I was reading that too, it seems like particularly in health, sort of health-focused recessions, it's the women who come out worse, like the Ebola crisis. It's the women who came out worse. And so the question is, like, what can we do now? And I'm glad that, researchers are pointing out these metrics and these widening divides. And, you are talking about violence issues and talking about, labor force and unemployment and, which industries are affected and how the technology divide is going to, make things even worse. I absolutely think, we need to, this has to be front and center for all policy makers. Like, of course, COVID is, we need to take care of the health health scare first. We need to, we need to have a country that can survive this. But then the gender focus and trying to come up with policies, whether it's, what we were talking about, like so many women work in the informal sector. Like, how do we make sure that all the benefit programs that are being promulgated actually reach them? How do we make sure that women, small entrepreneurs, micro enterprises are getting the support they need? And I think there is some learning. Like I was talking about the Paycheck Protection Program in the US, where they provided direct cash support to a lot of these businesses. We're learning from other countries. I think India can learn from others. I think right now we're in sort of every country is trying to take on the best practices from each other. So it's not a rivalry about who gets there first. It's really, as sort of a global entity, we need to get over the crisis first. But there are good practices and there are bad practices, and the good policies and there are bad policies. And I think we need to really, maybe you guys can be sort of the framework for putting together this agenda for what do we need to do to address this gender divide in the COVID, that the COVID pandemic is worsening. And, these are the top set of 5 policies that would help women, get over the crisis. I know we write about that a lot in the US. We're talking about the burden of unpaid care, the childcare responsibilities that primarily have fallen on women, how that's affecting their labor force participation, and how, it's just sort of, it's all the stuff we've talked about for years, but it really came to the forefront when it came to COVID, because everyone has known for decades that, yes, women tend to have lower labor force participation because of all the responsibilities that they're facing within the home. But COVID really brought that, out very starkly. The fact that people did not have, schools or daycare centers or childcare centers to send their children to. The kids were learning at home, parents are learning at home, and now it's all showing up in the data that is a big reason why women are dropping out. That's a big reason why their productivity is low. So I think, just hammering those points, but saying, in a more positive, constructive way, okay, this is what we can do to address this aspect of, the gender aspect of this recession. I think coming up with a framework for positive policies that can help women, that can help mothers, and that can help families. We're not, this is not trying to pitch men against women or mothers against fathers. Ultimately, as a family, we want to survive the crisis. And what I keep finding in my paid leave work is that, fathers want to be actively involved in rearing a child. Fathers want to be able to take that time off from the workplace. It's just that sometimes it's employer level policies. Sometimes it's, federal policies or government policies that are saying, no, you don't have a right to do that. Or you don't, you're not, you did not deliver the baby, so you don't have a right to stay home. And I think, we have to change that mindset. There's both a cultural mindset. There's a legislative mindset that, oh, these laws don't apply to men, these paid benefits don't apply to men. I think we have to overcome that, and that has to start with making policies more gender neutral. That comes from taking that initial step and saying, no, it's your joint responsibility. If a mother is taking time off, it's the father has a right to take time off, and the father needs to take that time off. If you're within the home as families, and you have caregiving responsibilities, let's try to figure out a way to share them more equally. Let's get the job done. Let's enable women to continue to participate. Let's enable men to continue to participate. So I think you're on the right track. You're highlighting these, the divide, just like, researchers all over the globe are. But we also need to then figure out, okay, what can governments do? How can policymakers respond? Whether it's, providing unemployment insurance benefits, whether it's providing support to businesses, whether it's, providing a more affordable childcare options, whether it's supporting childcare centers, whether it's allowing a reopening of schools, in a safe way. Like, all of these have to be part of the mix of policies that, we need to think about as a whole, I think, in order to get over the crisis and to make sure that instead of exacerbating these gender divides, we're actually narrowing them to some extent.
Right. Yes, Suhela has a point to me.
Yeah, I'm sorry, but I
problem.
felt compelled to make
Yes.
a point. Aparna, you started talking about positives, and I think we should talk about positives. One of the things that I would like to bring to your notice, Simi, and for others as well, Aparna, of course, that there is a decent job potential, decent job creation potential in the care economy itself. So the fact that, ILO has come up with this study, I think in 2018 or 2019, and they did some simulation exercises around, the fact that if the government invests in education, health, and infrastructure, India has a potential of creating some 63 to 69 million decent jobs. So and of course, so there is a positive side to this aspect as well. It's just the fact that we have to keep recognizing that and keep pushing it. So this is a food for thought for IMPRI, maybe.
Absolutely. Thank you, Suhela.
That's a great point,
yes.
Suhela. Yeah, I mean, we talk about the care economy workforce here too. It is a workforce. It's not, and we like right now the Biden administration is talking a lot about the care infrastructure. And why are we calling it infrastructure? It is infrastructure because it enables people to be out there in the workforce. It enables you to do things that you wouldn't be able to do. It enables women to participate and have jobs. So I actually agree with that. There's a whole investment to be made in the care side of things that can be both positive for parents and families, but also positive for the workforce that's engaged in those occupations too. So you're absolutely right. That's a great point.
Thank you for that intervention, Suhela. And Dr. Aparna, there are a few questions, and mostly they pertain to your set of recommendations vis-a-vis between India and US. So I would want to read them out to you. So first is, what is your recommendation when governments seem to wash their hands off when they need to give financial support to women or preferential treatment while protecting their livelihood, especially in the informal sector? Another recommendation that is sought here is that would you recommend tax breaks or tax reliefs for women-led businesses, especially for the pandemic times? Maybe Suhela could add to this. So if you could take these two first.
Yeah, sure, absolutely. I mean, I think government policy first and foremost. We haven't. At least the effort has always been to keep it gender neutral. So the effort isn't, okay, let's only support women-owned businesses, or let's only support, provide tax breaks to these businesses, or only provide cash support. I think when we think about it from the government's point of view, there has to be a lot of support going to families. And so that was the purpose in like March and April 2020. The US government passed the CARES relief bill, which was a massive, over $1 trillion was spent on that. But the whole idea was, let's provide what the country needs right now is a lot of direct cash support, right? Because people had lost jobs, people didn't have incomes, they didn't have a monthly paycheck coming in. How do we address that immediately? And so what we did was we sent out cash checks, to families. So whether you were a man or a woman or even a child, there was a certain amount of cash money that was sent. If people lost jobs, the unemployment benefit system kicked in. Unemployment benefits were extended massively. Like we were giving people an extra $600 per week on top of their regular unemployment insurance. In order to survive the crisis. So there was a lot done. And again, for small businesses, the Paycheck Protection Program gave them cash so that they could, if they kept employees on board, they could survive the crisis and they would be forgiven the loans. So and when it comes to talking about gender-based policies, I get where you're going. I absolutely, I don't want a government that sort of says, well, we can't be, we shouldn't be doing too much for women, or, our concern is with men. But I do think that a certain level of gender neutrality is required. Now, if you're seeing that there's a certain sector, so for instance, in the US, we saw that the childcare sector, the childcare providers were really suffering during COVID. Like a lot of people pulled their children out of childcare centers. They were not eligible for PPP money. And so there was a lot of, relief that was targeted directly at them. So I think what, and those typically tend to employ women. So my point is that even broad-based policies that are universal, that go after the industries that are struggling. So in India, if it's the service sector, if it's the women and minority-owned businesses, if it's certain types of jobs, like you're saying, even in the informal sector, I absolutely think you need to do a lot more. You need to be, maybe it's direct cash support, maybe it's cash supports that's directed towards childcare, being able to provide affordable childcare, being able to access a childcare center, being able to do, provide some relief there, whether it's providing a support to businesses. You can, tax breaks. We did a lot of, we provided some amount of payroll tax relief to businesses in the US as well, so that they could defer tax payments, to the government. So yes, absolutely. There was a whole mix of policies. I think at one point we were like, everything can be tried, because we can think about the fiscal impact or the cash impact once we're over the crisis. But right now, what people really need, and I think India is in that state now, where all we really need is to find a way to get through to the other side. And if that means providing direct cash support, providing any support to businesses, and you're well positioned to sort of highlight where the need is greatest. I think if you can make that case and say, look, these businesses in this area are really struggling because, the virus is really rampant here, caseloads are really high here. Absolutely. I think you can make that case, and we need to be doing a lot more. So I think at this point, anything and everything should be on the table in terms of providing some cash relief, direct relief to families and businesses.
Right. Suhela, would you want to add to it?
I think the tax bit is good if it comes from an economist, so I won't comment on that. But yes, we know that in rural India, the major crisis that is being faced right now is the food security, right? Because there are no employment opportunities, there are no, the work, majority of them were quite happy with the MG and REGA kind of work that was given to them. But all of this has been stopped due to these preventive measures, and there has been an urgent emergency for food security, and also towards the cash to buy medicines, because at this point of time people are really struggling with cash crunch. And I do agree with Aparna that we have to prioritize, we have to see that what is it that is immediately required, what is it that is that would work in a medium term, and what is it that we can think about long term. So of course, I completely agree with you that a mix is required, but if we would really like to address the immediate concerns, cash transfers do seem a viable option. Yeah.
Absolutely. I mean, that's exactly what we're saying. We're saying, people tracking hunger statistics, tracking food insecurity, tracking rent payment. It's like the day-to-day stuff is so difficult for families right now. And especially now when cases have suddenly increased, every family member you talk to, there's somebody in a hospital, somebody who needs help at home. So I think, doing a lot more to meet those day-to-day needs is critical. But then, of course, you have to have a plan for, okay, what's the slightly medium term, what's the longer term, as Suhela pointed out. We need to figure out what the priorities are currently, as opposed to the longer term.
Yes, especially when the Anganwadi centers are closed, they are almost sometimes closing, they are again coming back to trying to get back to normal, wherein they prepare food, and then they serve to the children. And then it's all gone. You just have dry ration that is being provided, door-to-door deliveries being provided. But then it doesn't yield much because it does not provide the nutrition security that is important for the proper growth of the children. So definitely. And so one more question I would like to pose to you, Dr. Aparna. There is a sort of frustration in the questioner, is that India doesn't want to appear that it needs aid and assistance, but in reality it needs it. In this complexity, people are suffering. How would you reconcile this kind of Atmanirbharta? And is there any fear of third wave in the states? What is the government doing to prepare for it? And what recommendations would you have for India? Yes, over to you. Dr. Aparna. Is the video stuck? Arjun, can you hear me?
Yes, it seems like stuck. Suhela ma'am can go till then.
Yeah, sure. No, I completely understand what you are trying to to discuss here, but what we have increasingly what I've seen is that I think there is a recognition now that we do need aid and assistance, and we do see now that India is trying to open its doors to get more aid and assistance coming in. And we have seen, the countries, neighboring countries and other countries have come in and trying to support us in this time of crisis with various needs, including oxygen support, including the support towards medicines and all that stuff. So I think that that some of the there is a realization that we can't that there is a need to reach out, and I think increasingly this has been realized and being taken care of.
Yes, that's very right, and especially when we were not in this stage, we did our best to reach out to other countries with the whole vaccine COVAX diplomacy. So I think the time is right that if things are needed, we should welcome it with open arms instead of having qualms over our so-called maybe some supreme superior motives that we have. So definitely. So yes, Dr. Aparna, glad to have you back.
I dropped
Yes.
off. I don't know how.
No issues.
Yeah.
No issues. Yeah. Yeah.
So
would you want me to repeat the question?
Yes, please. Yeah.
Yeah. So one is about the India doesn't want to appear that it needs aid and assistance, but in reality it needs it. In this complexity, people are left suffering. How would you reconcile this kind of Atmanirbharta? And there is another question about, is there a fear of third wave in the states? And what is the government doing to prepare for it? And what are your recommendations for India towards preparing for a third wave?
Right. I mean, so again, I don't want to speak for the government of India. I don't represent the government of India, but I think there's a related point, which is that I don't think there should be any hesitancy in asking for aid. This is a global crisis. Every country has struggled through it. Every country has relied on, whether it's vaccine support, like India is the biggest vaccine producer, and I know a lot of countries are relying on them to produce vaccines and provide aid that way. If India needs aid, if India, I know we are working personally to try to ship oxygen concentrators. I know a lot of companies, I know a lot of nonprofits in the US are trying to figure out whatever India needs in terms of vaccines, oxygen, is there a way that we can mobilize here to send supplies to India? So I don't think at this point it's a question of, let's be Atmanirbhar, let's try and do everything ourselves. I think every country has sought support and every country has tried to figure out the best way to access it. So absolutely, I don't think there's any shame in doing that. I think at times of such need, we all need to rally together. In terms of a third wave, I just go back to the Spanish flu. We keep looking at the Spanish flu sort of example, which happened in 1918, where again, India was the worst hit. And also there were many, many waves of the virus that came. Now, I'm not an epidemiologist. I'm not trying to say, that therefore, this is what's going to happen in India. I'm also reading just what you're reading in the news. But again, it's better to be safe than sorry. I think we need to be cautious. I feel the same here in the US. We were discussing before the talk that mentally, I think, even though a lot of us know that, yes, we're fully vaccinated, half the country is fully vaccinated in the US, it's safe for us to go out. We're not going to be hit by the worst forms of COVID. And yet, when I see the situation in India, I worry that, is something going to come back here? Is there a new strain? Is there, are we being very lax? Should we be more cautious again? So I would just say, our best, our safest measure is to make sure somehow or the other to get the vaccine. That's what's going to be the most helpful going forward. Hope that our companies, the vaccines that they're developing, are effective against the strains that are likely to come. But yes, maintain the precautions that we are all taking right now. I'm still wearing a mask, but do what's your best judgment. I know in India, the situation is even worse. So I would just say, be careful. And instead of sort of worrying after the wave is here, I think it's best to be prepared and hope that there isn't a third wave. That if we are all fully vaccinated, then maybe, we're not as badly hit. And that even if we get COVID or some strain, that we're not being rushed to the ICU. So it's just, I'm just saying, be cautious. That's the best we can do right now.
Right. Thank you, Dr. Aparna. And I would just, before closing the session, may I just request Suhela to present her views, final parting views on the way forward, or any concluding thoughts you have for like.
No, I don't have much to say. I think Aparna concluded it very profoundly. I just wanted to say that, we really need to come together. I think this crisis, if we need to solve, we need the support from all the different players. It's government, it's private sector, it's civil society organizations, and the citizens themselves. Before this session was on live, we were just discussing the fact that, we have seen the best part of humanity and also the worst part of humanity during this crisis. So I know we've personally learned a lot. We have professionally learned a lot, but I think what we can do is to come together and work in cohesion to come up with the strategies to address this challenge. Yeah, that's it.
Right. Thank you, Suhela. And yes, Dr. Aparna, your concluding views.
Yes, thank you so much for having me on. I think, this has been an eye-opening discussion for me too, and to, I follow the US a lot. I follow India a lot, but I'm slowly, as part of this talk, I was like, oh, this is a much bigger phenomena, and this is a global, crisis, in the sense that the statistics on gender divides and wage gaps and so on are just universally applicable. So it's, I've learned a lot from participating in this conversation, and thank you for all of your insights. And I hope that, what we can take from this is an action plan, not just, oh, we found this research and that research, but really what can we do going forward that will help address the, the statistics that we're highlighting, the gaps that we're highlighting. So I hope, IMPRI, Impact and Policy Research Institute, will come up with, these are the top 5 sort of best ideas for how we can address these gaps, and, post-COVID, hope to narrow and maybe eliminate the gender divide in, employment, wages, all the other metrics we talked about. But thank you so much for having me on.
Sure, definitely, Dr. Aparna, and we would definitely be doing it, and we'll be sharing it with you and Suhela and all the others who would be interested. Definitely, please, we will definitely do that, and we'll also be coming out with an event report, which we'll be sharing with you on this, and that will be published on our website. So thank you so much. I would now like to really conclude the session and formally propose the vote of thanks for such an illuminating discussion, and very interesting and very interactive, and also coming straight, candid, and coming straight from your hearts, and talking about an issue that really matters to us all. So thank you so much. I am really grateful on behalf of the Gender Impact Studies Center at IMPRI. With we couldn't have, unfortunately, Professor Govind Kelkar. I hope her emergency situation is not very serious, but definitely we wish her all the best. Thank you so much to our speaker, Dr. Aparna Mathur, and our discussant, Ms. Suhela Khan. Thank you for your time, and I wish you all a very good day. And please stay safe. Please stay safe and stay blessed. Thank you so much.
Thank you. Thank you for having us. Bye.